Hey guys, so I had a request to see my clinical bag. Um, for clinicals last year, we took a lot of books and we had to do a lot of pathophysiology papers. And so we took a lot of our textbooks, and what we ended up doing is in our clinical group kind of divided up. One person would bring one book, and another person would bring another book, and then we had all of them there that we could use, all the whole group would use. So that helped because you carry so many books around. Um, right now for this year, I have all my main books with, and then we'll do that again after our first clinical day. What I actually take to clinical, I have one book bag that is specifically for clinical, and I keep all my clinical stuff in it. So my book bag is just a regular book bag. On the front of my book bag, I just got this actually at Walmart this year, and I love it. It's just a calculator. It flips down. Woo. So it opens up, and it's just a calculator, and it clips on. And I love it because we always take math tests for clinicals. So you always have to have a calculator, and I thought this will be really cool after school too, and I'm actually working. I can clip it on my bag for work. So this is my bag. It's just a bag from Walmart, and it's big enough to hold all my stuff. In the front of my bag, I have a pencil pouch, and in here I have another calculator, and then my pens and my pencils. Basically this more for math tests that we have to take. So I have that in there. I have my name badge for clinical. I actually have my old one in here too, just in case I forget my new one. I have lotion, which most of the time, wherever you have clinical at, they'll have a certain lotion that they will have out that you can use so that your hands don't get dry from washing them all the time. And then I also have chapstick and mints, and then alcohol wipes in this front pocket. And when you get to clinical, you always grab like a handful of alcohol wipes, and then I try to use them. If I don't use them, I actually will throw them away because I don't want to have like any contaminants on there. It has a middle pocket. In my middle pocket is where I have my stethoscope, and this is a Littmann lightweight #2 stethoscope. I got it for Christmas a couple years ago, and I have the purple one because I wanted one that was a different girly color, and hopefully no one will steal it. I actually did have a cover on it for one clinical rotation, but my instructor had me take it off because it can hold contaminants from going from one person to another person. I didn't realize that, but I also got last year for graduation, I got a automatic blood pressure cuff, the wrist one, which a lot of places are using these now, but I figured I have one just for like a spare. I also have a manual blood pressure cuff that I got, and it has daisies on it because no one will ever steal this one, I'm sure. At least no boy doctors or nurses will steal it. I have a gait belt from when I was a CNA, and I keep that in there, and I always put that on just because it's such a habit, and then you always have a gait belt. And then in this little bag is my thermometer, alcohol wipes, and extra light in case I need it. These aren't required to take to clinical. Basically, the only thing you have to take is your stethoscope, but I just have it all in my bag because that way if I'm at home and I need something, I know exactly where it's going to be. Then in the big pocket, I keep all my books. So first I have my nursing diagnosis book that's in there. For care plans, you want to have this with. And I also have my lab book that's in also for care plans, or if you're working on a patient and you need to know lab values for something, you have to have that. I have my skills book for any skills that we are asked to do to make sure I can go through it myself and then with the instructor before I go in to do any catheters or IVs or anything. And then I also have my drug book. And for my drug book, I do have it tabbed off for all. We had a list of drugs last semester that were ones that we'd see a lot, so I tabbed them all off, but I really don't use the tabs much. I actually end up looking them up anyways. And then I also use my pharmacology cards that I showed in my last video, and I have the ones that we use a lot in there. And I'll keep that actually in my pocket so I don't have to dig out my drug book unless it's one that's not on my cards. And then I have my folder for the semester, and in here I have our schedule for all of our care plans and our math tests, and then our syllabus is in here, and then it just kind of breaks it down to like what we'll be doing in a contract. We also have like planning sheets that our school has us print out, so we kind of know how to separate our day out, and there's a worksheet every day that we do for patients as well. But I just keep everything in here, our facility evaluation sheet, our final evaluation for us. I keep everything in this folder so that way I have them all. And then the last thing in there is my clipboard. I got this at Walmart, I think. It actually opens up. And I keep all of my notes, like my calculation conversion up there, my little IV chart for the colors, all that kind of stuff I keep in there. We got passwords for different places too, but those are all old, so I don't need those in there anymore. But then, so that way I can kind of review my calculations quick, the conversions, before we take a math test. And then the other thing I keep in here is a notebook, and then our list of important medications that we'll see a lot. But this will get fuller throughout the semester. I'll keep my extra planner and sheets and stuff in here. But this is what I keep on me pretty much the whole time at clinical. And I use alcohol wipes or the bleach wipes and wipe it down after we're done with clinical. Then in this side pocket here, I have my RN notes. This is a nice quick reference. I don't normally carry it around with me because I always have my drug cards in there, but I do keep a little notebook in my pocket so that way I can take notes. If like doing reports and stuff, I can note down anything, or I normally try to write it on the facilities paper that we get. And then everything else that goes in my pocket pretty much is what I keep in this side pocket. So when I get to clinical, I take all of this out and I put it in my pocket. So first I have my just chapstick, and then I have a couple of pens that I keep in my pocket. I always keep a couple in case one gets stolen. I have my scissors in my pocket, which it's black with pink hearts on it. I get really girly stuff. And then I also have my pen light in my pocket. So that's the stuff. When I get to clinical, I take that stuff out of the side pocket, I put it right in my pocket, get my stethoscope out, put that on. And that's pretty much everything. The other side pocket over here, I keep like ibuprofen, girl stuff that you have to have. And that's pretty much everything that's in my clinical bag. I also have a shoe bag that I take my clinical shoes, and I don't wear them outside at all. I just wear them into wherever we're having clinical at, and then I switch my shoes there. And again, when I'm done with clinical, I try to wipe them off with bleach wipes every now and then, especially if they get dirty. But otherwise, I just put them back in that shoe bag and keep it. And then at the end of the semester, both semesters last year, I just washed my shoe bag. So that's pretty much it for clinicals. They can be stressful a little bit. You can be a little bit anxious about clinicals. This year I'm really excited about them because I already know a lot of stuff from last year. I always like clinicals because that's your hands-on time and you get to be with patients and you get to learn better than in the classroom. And all of our instructors are always really awesome to have. So, but if you have any other questions or comments, let me know. And hopefully this video was helpful for you. Thanks.